my daughter is suffering from sickle cell anemia. She's 14 years old, and I didn't like the fact that she had the disease. I wanted a solution to get rid of the disease. I heard about the bone marrow transplant several years ago, and I contacted the Sickle Cell Society in Nigeria, and they recommended Dr. Gaurav Kharya to me.
Amarachukwu came to us with a diagnosis of sickle cell disease and its associated complications. And she came here for a curative options. They wanted to cure this disease forever. So they came to us for a proposed bone marrow transplant.
When I first met Dr. Gaurav, I find him to be very attentive, very patient in explaining the transplant procedure, because my awareness at the time was very rusty.
When they came to us, we evaluated Amarachukwu along with her sibling, and fortunately we found an actually identical, genetically matched donor in one of the siblings. But in her case, the challenge was her age, because as the age increases, the chances of complications, the complexities of the transplant increases. So at this age, there were some of the challenges which were there, which we discussed face to face with Amarachukwu and the family members, parents. And after a detailed discussion, we opted for a bone marrow transplant.
Prior to the bone marrow transplant, Amara used to have chest pains. She used to have pain in her body, leg, and her arm, and she was unable to take part in sport activities in the school. But because of the sickle cell disease, she was unable to do so.
Amarachukwu tolerated the transplant process pretty well. So uneventful pre-transplant preparation, uneventful transplant course, and even the post-transplant complication was complicated by just one viral infection, which is BK-induced hemorrhagic cystitis, where there is a viral infection of the bladder. So that was, I think, the most difficult time for Amarachukwu, but we managed to bring her out of that.
It's past 100 days post the transplant. She's extremely vibrant. She's now energetic more than before, and the pains that she used to feel. I'm extremely happy with the service that I received from Dr. Gaurav and his team.
And today you can see her. She's more than 100 days post bone marrow transplant, doing extremely well. All her sickle related complications, she's free of all of them, and she's looking forward to a brighter future. We at Indraprastha Apollo Hospital wish her all the best in her future endeavors. Namaste.
Apollo Hospital is a huge hospital. I would recommend the hospital to anyone else. I would like to thank Dr. Gaurav and his team and Apollo Hospital for the treatment on my child.